We're pleased to welcome Eric Smith to the Cedarville University newsroom today. He serves as Chief Financial Officer for the Cincinnati region of Mercy Health. And more importantly, he's a Cedarville parent. And so we're glad to have him with us today. And thank you for giving us a little bit of your time. We're going to talk briefly about the link between healthcare and business. So I just got a couple of questions. From your experience, Eric, why is it important that healthcare professionals also have business skills?
I think what I've seen in my career is that someone who is a specialized, like a nurse, for instance, if they can understand the business side of the operation, it makes them a much more impactful leader. Because one of the people that I think of the most is a COO I worked with at one time at my last hospital. She had a doctorate in nursing, and she also had an MBA. And so what would happen is we'd go into and we'd be dissecting an issue and how could we make this better. And she could, on one hand, talk about the nursing and the impacts to the nursing and the patients. And then on the other hand, she could talk about the financial implications and the business implications. So it really, I mean, to use the term a dual threat, she could talk about all aspects and really bring a lot to the table. And I think anybody that can bring more than just one viewpoint really is a valuable asset to an organization.
So one of our newest graduate programs that we've worked on is an online MBA and a healthcare administration track. How do you think an MBA specifically would benefit healthcare leaders? So you've mentioned nurses, doctors, pharmacists. How do you see that going together and really benefiting their careers?
I think as I think back on my career in healthcare, which is over 22 years at this time, some of the best leaders had both components. And in the world today of healthcare, what we're really seeing is a shrinking of the margins. And so the insurers and the payers are trying to lower what they're paying, and at the same time the suppliers who are putting all this research and development into their products are trying to increase the costs. And who's caught in the middle are the healthcare providers. And so the margins are shrinking, and so if someone can come in and look at this and say, you know, I think we can improve some efficiencies or some savings on this procedure, let's say, it's going to be more impactful, and especially given this climate of healthcare that we're in, it has become to the point where some facilities can't make it any longer. So somebody who can bring all those components with an MBA can really help their organization not only thrive, but survive.
And that's really one of our goals with the MBA program, is to give that real-world experience that our students, our graduate students, can take back and apply in their situation setting, and in this case, healthcare.
Right.
So Eric, thank you so much for being with us today. It's been very helpful. Appreciate your input.
Thank you, my pleasure.